sharing it with you every Wednesday to give you a more clear picture of the trajectory and the dispersion of vaccines coming into our region. I will note this does not include VA or Department of Defense numbers. We don't yet have access into those, but this gives us a general sense. Next, we will go to our dashboard. Here you can see the 2.3 million doses administered. I alluded to 65% of the way towards our goal with first dose, more than 42% of the way towards our goal with fully vaccinated. Again, 846,000 San Diegans fully vaccinated, and we expect these numbers will climb along with all of the normal demographic data we routinely share. Next chart. Here you see our cases, and again, you're going to have fluctuations, a day at 152 or 149, a day at 317, along with the fluctuations in testing. But in general, what you'll see here is a generally stable situation. That percentage of positive remains slightly downward trending, but holding right there, right around 2%. I think we're at 1.7% now for the 14-day percentage of positive. But again, you can see a general trajectory, and as more people engage and interact and move around, there's more opportunity for spread, but there's also greater protection every day by those who are getting vaccinated. Next, we will show you the normal, very busy, crowded chart, but you all are used to seeing it now of the tier system. Again, this week, not a significant change. We went from 6.0 to 6.1. Under the old system, this would have been cause for alarm, but again, the state has adjusted the rules around the tiers, and so we're not in any risk or danger of backsliding into the red tier. We're going to be in orange, stay in orange unless our case rates descend. But again, we are looking ahead to that June 15th date, which is not too far away, which is the anticipated retiring of the tiers by the state of California. And then the final two I just want to show you to demonstrate the kind of relative stability. And again, you're going to see upticks up and down in little amounts, but over the last 30 days, again, you can see a decrease, but relatively stable surrounding hospitalizations, and you'll see something similar here on the ICU data. Again, over the last 32 days, you're going to see upticks up and down, but again, very stable situation, and we encourage all San Diegans, look, let's continue to be safe, continue to utilize that face covering, avoid those high-risk settings. Now is the time as we're doing our recovery. Kids are going back to school. Businesses are reopened. We want to continue to be a leader, to be safe, to be strong, to get people vaccinated, and to work ourselves out of this in a positive way. Next, we'll hear from Supervisor Nora Vargas. We'll take your questions, and Drs. McDonald, Shaw, and Wooten are all on hand for your questions as well.
Thank you, Chair Fletcher. As we mentioned before, we continue to place equity at the forefront with continued efforts to increase vaccination rates, especially in hard-to-reach communities. We're doing that through partnerships with trusted communities and faith-based organizations to ensure that everyone has access to the vaccine. I do want to share that we are looking at expanding some of our Project SAFE programs up in North County that we piloted in South County to ensure that we're meeting the need of our hardest-hit communities. While the vaccine is one way to combat the pandemic, I also wanted to let everyone know that early treatment is available for people who test positive for COVID-19. And on Monday, I was very proud to join our wonderful partners at San Isidro Health Center and the City of Chula Vista to open up the county's second monoclonal antibody regional center, also known as the MARC site, in partnership with San Isidro Health. It's located at the former Chula Vista Fire Station number 5 at Oxford in Chula Vista, and it's at the heart of South County, where disproportionately members of our community have been impacted by the pandemic, which is the area of 91911, one of the hardest hits. What we decided to do is that the county decided to do that after we made an informed decision to make sure that we wanted to locate the second MARC site in Chula Vista because the first one is at the Palomar Medical Center, and the Palomar Health Center has treated already 187 patients to date. We've heard wonderful testimony from patients. Basically what this therapy does is if you do get COVID, you're able to call this number, and then people come, and then you're able to get a treatment specifically to help you so that it doesn't get worse for you. And so some of the comments that we've heard from some of the patients include, a patient treated on February 16 said that he felt like a new man. Another one named Daniel said that on February 26th, he felt amazing, like he was on cloud nine. And so what happens is people come, they are able to reduce the risk of COVID-related hospitalizations and emergency visits, and we want to make sure that everybody has access to these treatment situations. What's really important is that the information is in English and Spanish, and we are able to make sure that people have access to this information as well. The treatment doesn't take more than 45 minutes. They are open 7 days a week, and I think it's one of the many ways that we're going to make sure that we combat the COVID pandemic. Como dijo el supervisor Fletcher, nuestro suministro de vacunas ha aumentado esta semana. Hemos recibido más de 100,000 dosis de lo esperado en la región. Y esto es importante porque todavía los casos de COVID y hospitalización siguen ya estables. Es importante que aunque la gente se haya vacunado, sigan manteniendo su distancia, usen su cubrebocas y eviten reuniones grandes. El condado sigue con su compromiso de equidad en la salud y en lo que es la distribución de las vacunas. Estamos asegurándonos que en las intervenciones que usamos en el sur del condado, del Project Safe, van a ser introducidas en el norte del condado también, porque sabemos que esas intervenciones funcionan. Si bien la vacuna sabemos que es una de las formas para combatir la pandemia, pero también queremos recordar a todo el mundo e informarles que este pasado lunes tuvimos el honor de abrir un nuevo centro regional de anticuerpos monoclonales del condado de San Diego, en el sur del condado, o MARC como se le llama por sus siglas. Es el primero de su tipo ubicado en el sur de San Diego. El otro está en Palomar Health. A mí me dio mucho gusto hacer esta colaboración con la ciudad de Chula Vista y con San Isidro Health para poder entrar esa terapia a nuestras comunidades que han sido gravemente impactadas durante el COVID-19. Lo más importante es que quiero que todos sepan que esa terapia funciona mejor si se administra lo más pronto posible como se desarrollan sus síntomas, sin importar qué tan leve sea. El sitio de Mark en Palomar Health ha tratado más de 187 pacientes hasta la fecha. Una de las personas dijo que se sentía como nuevo. La otra persona, el señor Daniel, dijo que sentía como que estaba en las nubes de también que se sentía. La terapia puede ayudar a reducir síntomas y prevenir la hospitalización y visitas a las salas de emergencia relacionadas con COVID para que pueda regresar a su rutina diaria como antes. Este tratamiento está proporcionado sin costo y está abierto a todos los que son médicamente elegibles y no importa su estatus migratorio o de seguro médico. Así que es importante saber que ese procedimiento dura 45 minutos, está abierto los 7 días a la semana y pues cualquier persona que tenga esos síntomas que por favor hable al condado y le pueden dar la información para que pueda contraer este tratamiento. De ahí en fuera solo recordamos que siga usando sus cubrebocas y distancia porque tenemos que mejorarnos lo más pronto posible. Gracias.
Thank you. We'll now go to our call-in questions.
All right, the first caller is Matt Hoffman with KPBS.
Hi, I know we talked a lot about supply outpacing demand, and obviously that's still, demand outpacing supply, and obviously that's still the case. But with that gap sort of closing every day, do you have any idea of when we'll reach a situation where that shifts, where we have more supply coming in than demand, and then what sort of happens once we reach that point?
Matt, come on now. You've been doing this for a year. We haven't been predicting the future for a year. I'm not going to start now. I don't know when that's going to happen. I think, given the volume that we're getting to and the number of folks that have been vaccinated and we continue to see tremendous demand, I think that is encouraging. At some point, there will be more first dose appointments available. When that happens, our efforts around engagement and really working with folks and talking about the value of the vaccine, all those efforts will certainly continue. But I want to remind us that we did some public opinion survey work at the end of the year, beginning of the year, and we saw that almost 3/4 of San Diegans at that point were ready to get the vaccine. We think that number has only increased because one of the leading drivers of folks who didn't want to get it was they said it was too soon, and that was a concern in December or January. But given where we are now, I think that's probably less of a concern. So, not saying it's not a concern, and when we hit that point, we'll do aggressive outreach and work and continue to make sure it's available to everyone. But I think in general, we're on a good trajectory, a good pathway, and I just couldn't predict at what point we'll have slack in the appointment system.
And then I know that J&J vaccine you guys have been using on a number of different fronts to vaccinate high-risk individuals that it might be hard to get like second touches on. I know you kind of alluded to some of the doctors may have an update on J&J. Do we know when that might be coming in, or what?
Yeah, I'll let them comment. I'll kind of let them comment on some of the thinking. I do want to point out that we haven't had any significant impacts. We had some of those targeted programs obviously had to switch to a different vaccine that was 2-dose, and so it will take longer to fulfill those and a little bit more challenging. But I don't think we have any particular insight on when we'll hear something from the federal government, but would love to have Dr. Wooten just comment on the situation with J&J.
Thank you for that question. The Advisory Committee on Immunization Practices is an advisory committee to the Centers for Disease Control and Prevention, and they will be meeting again on Friday. As you recall, they met last week, and they said they needed more time to evaluate and investigate the cases. So they are meeting again this Friday, and we will be waiting for the information that they have to share with the public as to what is the next step in continuing to, or not continuing with the J&J, but we just don't know that right now. We will know after Friday. Thank you.
All right, next call.
This next one is from Brandon Lewis with Channel 8.
Thank you. Just to follow up on Matt's question, are there any communities where demand is starting to wane? And can you give us some examples of the outreach that the county is planning to help encourage folks to get the vaccine?
Yeah, Brandon, we haven't seen any areas where there's a lack of demand. You know, we've walked through the program we have radio ads, we have digital ads, we have television ads, we have a whole public awareness campaign that is out there and is engaged using trusted messengers, you know, working with members of the community. So both the paid media campaign and the work we're doing around Project Save and our community health workers and our partnerships with various entities. And so, you know, we have a robust engagement process that is more targeted to those communities that may be more likely to be hesitant. But we continue to see tremendous demand. And I think when you look at the breakdown in equity areas, you continue to see a lot of those communities having really high utilization rates. And I think that's a testament to a focused effort around equity, setting up sites, making them dedicated, walk-up sites, having community health teams go out and make appointments. And so we just haven't yet hit the point where there are excess appointments anywhere. At some point that's going to happen, but we're just not there yet.
Thank you. And just to follow up from last week, any new updates on J&J as far as side effects that have been reported to the county?
No, we still haven't seen anything here.
Okay, thank you.
Thank you, Brandon. We'll go to our text questions.
This first text question is from Jennifer Dela Cruz with ABC 10 News. While more people are getting vaccinated, there are still some who don't want the shot. What is the county doing to combat vaccine hesitancy?
Well, we have an aggressive public education campaign that is well funded and is out there. We have trusted messenger campaigns that are engaging communities that are less likely to do it. We're setting up vaccine sites and appointment systems in a way to make it easy to access, and all of those efforts will be ongoing and continued.
This next text question is from Claudia Buccio with Univision San Diego, and she's asking for a response in Spanish. How will universities such as SDSU and UCSD continue collaborating with the county to vaccinate and test both community members and students when summer and fall semesters start?
Gracias por esa pregunta, Claudia. Era específicamente cómo universidades como San Diego State y otras universidades van a hacer el trabajo para encargarse de que se vacunen, ¿verdad? Es importante reconocer que tenemos una colaboración con la universidad, con San Diego State y con Southwestern College y San Diego Community College District, con las diferentes escuelas. San Marcos también hemos tenido participación con ellos. Entonces lo que estamos haciendo es seguimos creando colaboraciones y pidiendo pues a los estudiantes y sus familias que se vacunen, ya que ahora todo el mundo tiene esa oportunidad de tener accesible a las vacunas. Gracias.
This next text question is for Dr. Wooten, and we'll have Dr. Wooten come up and read it while it's asked.
And this is also from Claudia with Univision. She has a two-part question for Dr. Wooten. What are the county's health recommendations to universities as they prepare for in-person classes to prevent future outbreaks? And her second question is, now that vaccines are available to all age groups, would the county recommend requiring vaccines for college students?
So the first question is, we are working with all of the universities. We meet regular with SDSU because they had the outbreak, but we plan to convene a meeting in early May rather, to meet with all of the institutions of higher education. And we met with them previously as well, but to look at how we will plan for vaccinations for the fall year. So we will continue to work with our institutions of higher education. We have sector calls with them as well. That's led by our reopening lead, Gary Johnston, and we will continue those efforts as well. And the second question again?
The second part of the question was if, now that the vaccines are available to all age groups, would the county recommend requiring vaccines for college students?
Well, the decision for college students to be vaccinated is a policy decision for each of the institutions. And so again, we are working with the colleges and universities. We just met last week with SDSU. And just as a point of clarification, vaccination is not available for all populations. It's available for those that are 16 years of age and older currently today. That obviously will change in several weeks as the 12 to 15-year-old age group has vaccines available for them. But today, 16 and older, and we are, as I stated, working with our colleges and universities, institutions of higher learning, and it is their decision to make it a mandatory process for students to be vaccinated before coming back in the fall. Thank you.
Dr. Wooten, this next question is actually also for you, from Mike McKinnon with KOSI. How many coronavirus cases and hospitalization resulted from high school football in San Diego?
Well, you know, of the almost 1,500 outbreaks that are in community settings, and this would be a community setting, we've seen the occasional outbreak in sports or football teams or other sports among the outbreaks at K through 12. And that population is very small in the grand scheme of things of the total number of our community setting outbreaks.
Thank you, Dr. Wooten.
Thank you. Let's see if we have one additional text question.
And this one is from Rory Devine with NBC7. How many fully vaccinated San Diegans have contracted COVID?
We'll have Dr. McDonald take that one for you.
Thanks for that question. You know, we have over 750,000 San Diegans who are fully vaccinated. So that's, I think the exact number is 757,355. We expect to see some cases in that group. And as of yesterday, we have had a total of 203 individuals who were fully vaccinated, which is 2 weeks past their second shot or their first shot, if it was the J&J vaccine, who have had the diagnosis of SARS-CoV-2 infections. And that is a rate of 0.027%. That is about 3 times higher than if you go to the CDC's website and look at the nationally reported cases. There have been 5,814 cases nationally out of the 75 million Americans who are fully vaccinated. That's where the 0.008% stat comes from. So we're a little bit higher. We actually expect to see higher numbers locally than they report at the national level because the reports first come locally and then move up the chain to the state and to the national figures. So to again answer the question, the number is 203. We've had 0 individuals who have been hospitalized, 0 people who have died. In fact, the majority, 57%, have had no symptoms at all. These were people who were fully vaccinated, were tested for other reasons because they were in healthcare, for example, and then they were tested negative afterwards and had their infections resolved. So again, we expect to see those numbers. They're very, very low, and emphasizes how good, frankly, the vaccines work.
Thank you. Thank you, Dr. McDonald. That concludes our media briefing for today. Again, we encourage everyone to continue to be safe. If you haven't been vaccinated, get an appointment and get vaccinated, and we will be back with you next week. Thanks.